All right, so get this. We're diving deep into chest wall masses today. You know, that area between your collarbone and ribs. It's way more interesting than it sounds, trust me. We're talking benign bumps, weird medical mysteries, the whole shebang. And you've clearly been doing your homework because that stack of articles, especially that Diagnostic Strategies for Chest Wall Masses excerpts, screams deep dive, ready to unpack it.
Absolutely. It's an area that keeps us on our toes, always something new, even for experienced doctors.
See, that's what gets me, the surprises. You see a lump on an x-ray and you think you've got it all figured out.
Then, bam, you dig a little deeper, and it's a whole different story. That's why nailing the diagnosis with chest wall masses is so important. Something that looks like a simple bone tumor on an x-ray could actually be like a really stubborn bone infection mimicking the same signs.
Hold on, bone infections can actually disguise themselves as tumors. Tell me more.
Oh, absolutely. Osteomyelitis, for example. It's infection, right? But on an x-ray, it can look almost exactly like Ewing's sarcoma, which is a bone cancer. Really makes you think twice.
Wow, that's wild. It's like a medical detective story.
Exactly. And that's how doctors approach these cases, like detectives. It all starts with the patient's history.
Okay, walk me through this. What kind of questions are we talking about here? What clues are they looking for?
Oh, we're talking everything. Any recent chest trauma, history of lung infections, or any infections, really, travel history. Family history is important, too. Even things that seem small can make a big difference in the diagnosis.
So it's not just, hey, doc, I found this lump. There's a whole backstory involved.
Exactly. Let's say someone comes in with a mass near their sternoclavicular joint. That's where your collarbone meets the breastbone. Now, if they mention they've used intravenous drugs, well, that's a huge red flag. Makes an infection in that area much more likely.
Wow, context is everything. Okay, so they've got the patient's history, but what about actually seeing these masses? The article mentioned that x-rays are kind of old news now, right? It's all about CT scans and MRIs for chest wall masses.
Oh, definitely. Think of x-rays as a quick glance. Today, it's all about CT and MRI. They give us that detailed look inside.
Okay, but why those two in particular? What makes them so special?
Well, with CT scans, you see, doctors, they get really excited when they see calcifications in a chest wall mass. It's like a clue, you know? Points them towards a benign tumor, something they can often remove without too much trouble.
Calcification, so we're talking about like little calcium deposits inside the mass. That's not always a bad thing.
Exactly. It can actually be a good sign. Now, MRIs, on the other hand, they're like the detectives of the imaging world. MRIs show us the different types of tissue within a mass, and with incredible detail. We can often tell inflammation apart from a tumor just by looking at the MRI.
Wait, so you can actually see the difference between inflamed tissue and a tumor? That's amazing.
It's pretty incredible. But, you know, as great as all these scans are, sometimes the only way to know for sure is to do a biopsy.
That makes sense. I have to admit, though, the word biopsy always makes me a little nervous, especially when we're talking about potential cancers. Are there risks with biopsies?
You're right to ask that. There's a small risk of what we call tumor seeding, where the needle used for the biopsy could potentially dislodge some cancer cells, which could then spread.
Oh, wow. Okay, yeah, that does sound a little scary. How often does that happen?
It's very rare, thankfully. And doctors are very aware of this risk, so they take precautions. They plan biopsies very carefully, using imaging to guide them.
So it's not like they're just going in blind. It's a very precise procedure.
Exactly. It's like a high-tech surgery in itself.
Speaking of tricky, the article mentioned a real challenge. Telling benign and cancerous cartilage tumors apart in the chest wall, those sound tough to differentiate.
Oh, they are incredibly tricky, even when we look at them under a microscope. Chondromas, which are benign, can look very similar to chondrosarcomas, the cancerous ones.
Okay, so if they look so similar, how do doctors figure out what they're dealing with?
Well, that's when we bring in the really powerful tools, PET scans and those special nuclear scans. Think of it like this. These scans can see which cells are the hungriest. Cancer cells, because they're growing so fast, they're like, feed me. They light up because they're consuming so much more energy than normal cells.
Wow, so you're basically watching which cells are eating the most. That's wild. What happens then?
So this tells the doctors how to proceed. If it looks like a benign chondroma, they might just need to do a small surgery, nothing too invasive. But if it's looking more like a chondrosarcoma, a larger surgery might be needed. They need to make sure they remove all the cancer.
So it's about finding the right balance, taking care of the problem, but also minimizing the impact on the patient.
Absolutely. And that's exactly why having that accurate diagnosis is so important. It lets doctors tailor the treatment to each patient's needs.
It's like every chest wall mass is its own unique puzzle, and doctors are using all these tools and their expertise to find the solution. Now, the article also talked about other types of chest wall masses, like osteosarcomas and Ewing sarcoma. Those sound pretty serious.
They can be, yes. But the good news is they're not as common. Osteosarcoma is a bone cancer that tends to grow very quickly. It can cause a lot of pain and swelling. And we talked about Ewing sarcoma earlier, another type of bone cancer. We see that one more often in kids and teenagers.
And those often need chemo, right?
Often, yes. And sometimes chemo might be used even before surgery to try to shrink the tumor and make it easier to remove.
It's really incredible how treatment has advanced to target all these different types of masses. But what about soft tissue masses? Those seem like they could be easy to miss because they're not bone, right?
You're absolutely right. We can't forget about those soft tissue sarcomas.
Mm-hmm.
They actually make up a large percentage of malignant chest wall tumors.
Right, and because they grow in those soft tissues, like your muscles and tendons, they're probably harder to spot early on.
Exactly. They often show up as painless lumps that have been slowly growing for months, sometimes even longer, before the person even realizes it's there. So it's really important for people to be aware of any changes in their body and let their doctor know about anything unusual.
Early detection is key.
It really is. In the article, it really emphasized that with soft tissue sarcomas, a biopsy is crucial for diagnosis. But it also highlighted that those biopsies need to be done very carefully, again, to avoid spreading any potential cancer cells.
So it's all about strategy.
Exactly. Surgeons have to think strategically about where they take the biopsy from to get enough tissue for reliable diagnosis, but also to make sure they're not accidentally spreading those cancer cells during the procedure.
It's a delicate balance. The article also mentioned how even with all the imaging technology available, it can still be really challenging to differentiate some of these conditions. It talked about the difficulty in distinguishing between Ewing sarcoma and osteomyelitis, which is a bone infection, right?
Exactly. They could look very similar on imaging, almost like they're trying to trick us.
So even with the advanced CT scans and MRIs, sometimes doctors need more information.
Sometimes they do. And it really underscores just how important it is to combine the clinical expertise, the doctor's experience, with all these amazing diagnostic tools. In these tricky situations, doctors look at the patient's entire medical history, if they've had any infections recently, their overall health. Sometimes the only way to know for sure is a biopsy.
You need all the pieces of the puzzle to get the whole picture.
That's a great way to put it. Diagnosing a chest wall mass really is like solving a puzzle. You have the patient's history, the symptoms, the imaging results, and then maybe those biopsy results. And all these pieces, they come together to guide the diagnosis and then ultimately the treatment plan.
It really shows you how important it is to have a whole team of experts working together. Radiologists, pathologists, surgeons, everyone has to be on the same page.
You got it. And it's why those specialized centers, the ones that deal with these complex chest wall cases all the time, they can make a huge difference. They've got dedicated teams who eat, sleep, and breathe this stuff, so they're always up to date on the latest and greatest.
That makes me feel better, knowing there are those specialized centers out there. So we've talked about how we diagnose these chest wall masses, but what about the future? I mean, imaging technology has come so far. Will we ever be able to diagnose them even earlier, like maybe even before there are any symptoms?
That is the million-dollar question. And it's something researchers are working really hard on right now. There's a lot of buzz about developing these new imaging techniques and biomarkers that could detect these masses when they're still tiny, way before they cause problems.
Wow. Can you imagine catching them before they even become an issue?
Exactly. Early detection is everything. In the future, we might not even be talking about treating these masses, but preventing them altogether.
That would be incredible. Well, we've covered so much ground today, from how these masses are diagnosed to the amazing treatments available. As we wrap things up, is there anything else you want our listeners to take away from our deep dive into chest wall masses?
You know, I think the biggest takeaway is that even though these masses can be serious, we've made amazing progress in medicine. We have incredible tools to diagnose and treat these things effectively. But, and this is so important, early detection is absolutely key. So if you notice anything weird going on, a lump, a bump, any pain in your chest wall that doesn't seem right, don't wait. Get it checked out.
That is such good advice. It's so easy to get overwhelmed with all the medical information out there, but knowing when to advocate for yourself, to reach out for help, it's so important.
I couldn't agree more. Knowledge is power, especially when it comes to your health.
You got that right. We've definitely given everyone a lot to think about today. So to our awesome listeners out there, Keep learning, keep those questions coming, and keep diving deep into those medical mysteries. We'll be back soon with another deep dive into a brand new topic. Until then, stay curious.